Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you a little bit about the importance of movement, particularly when we're in pain. But before I begin, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So one of the things that I find with certain patients is when they're in a certain amount of discomfort, right? So for example, if they've had some form of acute maybe neck or back pain, for some patients, there's this tendency to rest, to essentially not move, to maybe put on some heat or lie down or sit in a certain way. And the idea here is that what can occur in these periods of time when we're in this type of muscle tension is the lack of movement can actually allow those muscles to go into more spasm, and the actual area where the muscles are tight, they can become extremely sensitive. And so the idea here that I try to emphasize in a lot of cases is we do want to move when we're in pain. It's just we want to make sure we're moving in the correct way. So for example, with certain conditions, we want to offload the body part with movement. For others, we might want to bias a specific movement. But the key is that we want to make sure that we're not just sedentary in terms of trying to help with our pain, right? There's very specific movements for very specific injuries at different times during when this injury occurs, whether it's more of an acute type of injury or chronic. And so one specific example, right, that I can give is if somebody has some form of muscle tension in their lower back where, again, they're not presenting with any sort of neurological symptoms, it's just tight. The muscles, the paraspinal muscles, they might be somewhat sensitive with transitional movements or with walking or weight bearing. And in a case like that, instead of just sitting and not moving, we want to, in a lot of cases, offload, so go into a position where we're not fully weight bearing so that the pelvis, the lower back, doesn't have to stabilize as much, and then do some form of ballistic stretch or ballistic type movements back and forth in order to allow those muscles that are protecting and that are guarded to let go. And again, there's other examples for different conditions, but the key is that, and I see this with a lot of patients, is we want to identify the specific movements that's going to be best depending on the patient's, when the patient's injuries occurred, whether it's chronic, acute, what type of injury has happened, if it's more of an extremity like the ankle or the knee versus the back or the neck. So there's all sorts of different factors in terms of the type of movement, but again, the emphasis is we want to move when we're in pain. Thanks again for watching. If you have any specific questions or concerns, feel free to leave a comment below. Have a great day, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and take care.